This is Sadie. Sadie came in last Friday for a dog fight at home with a sibling, and now we are here for a recheck to see if the drain should be removed and just to check the overall healing process of the pet's neck.
Which antibiotics this baby should be on. And then I'm gonna notate that this is open and not a lot of fluid. So be perfectly healed by the 2-week mark. So basically what we're doing is assessing the drain and the incision repairs. This baby was eaten up by another dog. Dog fights can be easy to handle sometimes, but they can also be extremely difficult to handle sometimes. So dog fights are the #1 attacks or places that we need to do surgery that get infected the most. So I do know that when this baby came in, we did a culture right away. A culture is us actually taking a sterile Q-tip, putting it all up and in and under and into that skin and into those wounds to make sure that we're getting a good sample of all the bacteria that is there. We send that to the lab. Unfortunately, that does take 5 to 7 business days to get back. So we are trying to fight this bacteria for as heavily and as fast as we can, as powerfully as we can with antibiotics until we receive that culture back from the lab. Once we get the exact bacteria and the exact number of bacteria, sometimes it can be 3 bacteria, 4 bacteria, 5 bacteria in this area, then we'll know exactly which antibiotics this baby should be on to heal all of these wounds. This poor thing was in so much pain when we came in. And today we are assessing whether or not this drain should be removed. What I will be seeing is how much fluid is really still there. The purpose of the drain is because when you get a wound or when you get a bite, and when you think about a dog fight especially, they bite and shake. So it is not just the wound you're dealing with, it's all the underlying tissue in between all of the bite wounds that you have to deal with. It will separate, the muscle will separate from the skin, and you're gonna have a lot of what we call dead space in that subcu area. That subcu area being the area in between the skin and that muscle. And so what we're evaluating here is how much fluid is still present and how are these incisions doing. So I'm gonna squeeze all around here. And then I'm gonna notate that this is open. However, sometimes we do leave it a little open to get a little bit more drainage because as you have all that movement underneath the skin and as you have that bacteria, you're gonna develop fluid. And so we wanna make sure the fluid comes out because if not, you're gonna have bigger problems. I'm not feeling a lot of fluid. I know you wanna scratch a baby, but you can't. And these up here are looking nice and healthy. We are only a couple of days out, so you're not gonna think that this is going to heal completely. There's not a lot of swelling and not a lot of fluid. So at this time, the assessment is that we could pull this drain. We could leave it in for another day as well if we wanted to, but we could also pull it now. And then we're truly waiting for that culture and sensitivity to come back from the lab so we can make sure we're on the correct antibiotics. We use data to ensure what we do medically. We are not here to guess. We are not here to have a magic ball. We are here to do exactly what is right for the animal and for the patient so their infection is cleared, their pain is handled, and we're doing the right thing for them.
Shh. It's okay. It's okay, lover. I know. It's okay. Good. Now we are going to cut this part. Shh. It's okay. And then we're going to pull this through. Good girl. Good girl. Shh. Good job. And now what we'll do is we'll just clean all this up. We'll do some scrubbing, clean everything, make sure everything looks good. All the sutures still look good and staples. And this baby is good to go. And we will be perfectly healed by the 2-week mark.